Welcome everybody, come on in. We're just about to get started. We've got a number of people on Polycom, even though that room shows one person. Welcome everybody. I'm here with Richard Corrigan, Deputy Commissioner for Administration. Dr. Trump, our Chief Deputy Commissioner. And I know Bob Hicks is on his way because we just came back from Arlington for the Public Health Nurse of the Year recognition, which went very well. We're really fortunate to have some amazing professionals in VDH, and it was nice to be able to recognize them because this is the Week of the Nurse, in addition to Public Service Week. So first of all, give yourselves all a round of applause because it's Public Service Week. Thinking about how to ask this next question. Everybody in this room works really hard, right?
Yes.
Yes. Come on. Yeah, that's the right. We work really hard. And we're all expected to do more with less. You agree with that?
Absolutely.
Every year. Okay. So in the beginning of May every year, we recognize that amazing effort. And that's what we're here for today. It's for you. So let me just thank you, personally thank you for the work that you do. I hope you know that I realize how important it is, and I work to represent you wherever I'm at. So I'm always eager to hear from you if there are other things I can do to represent public health in Virginia. I think that's a really important part of my job. That said, all of you, everybody, you represent public health every day, wherever you might be. You are VDH. And I know a lot of times it's us versus them mentality, but we are together, VDH. We are up in, bless you, in Northern Virginia, as I said, recognizing the public health nurses, and wherever we go, we are VDH. People see us as one entity, and it's really important that we be a collaborative, cohesive team, and I'm just thrilled to be able to recognize your efforts to do that. So, thank you. We have districts that are holding celebrations today. We wanted to do it here. We've got some of our other offices that are central offices, but not necessarily centrally located here, such as licensure and certification, the chief medical examiner, I think maybe even OEMS, I'm not sure, emergency medical services. But I welcome everybody who's here. Yes, we did. We're filling up the room quickly. And what we're doing this year is very similar to what we did last year because you didn't say you didn't want it. We heard some positive feedback. But I mention that because if you think we ought to do something differently next year, please let me know. I think that's really important that this be your celebration. And we don't have opportunities to do this, but I'm convinced we need to do more of that kind of recognition. Sometimes it's just a simple pat on the back, but it's also important to come together and celebrate our successes. How many people would say that the work is hard? And the people we work with and for make it harder? So, I mean, I'm not saying that regularly, that's just the way it is. Sometimes, we're all human, but we collectively can work together and make it a little bit easier on each other. And the way to do that is just recognize the efforts that we're each doing. And the best one, quite frankly, is day in and day out. So we're going to have prize drawings. We're going to have ice cream downstairs after this. I'm obligated to tell you there are no state funds other than our time. Supporting this effort, you should thank the office directors, the senior leadership for their contributions to make this happen. But none of it would happen if we didn't have the great work that you're all doing day in and day out. So thanks to you, thanks to the office directors, thank you to my colleagues as the senior leaders. So the first order of business, anybody else who wants to put tickets up here? This is your last chance, because I guess we're going to do some drawings. Michelle, is this time for drawings? Okay, so we'll do drawings. And if you're not here, we'll give it to somebody else. No, we'll. we have a deadline of noon tomorrow, and if we can't get you or whatever, we'll find somebody else who can get this. So The first one is the snack foodie basket. All healthy, right?
Chocolate chip cookies?
No sugar.
No, not allowed to look. Okay. Is it Panik Vutla? Did I pronounce that right? P-H-A-N-I-K? V-U-T-L-A? Okay, till 12 noon tomorrow. Oh for 1.
These are gift certificates in the bags.
Okay, the first one is Spa Finder Wellness gift card, 365 gift card. The winner is Betsy Marchand. Are you here?
She is sick,
Betsy.
or her kid is sick.
Oh, okay. All right, well, that's good. We can get her.
I'll get her gift card too.
And the
I'm
next
sure you
gift
will.
card is for Kohl's, $25 to Kohl's. Goes to Andrea Alvarez. She's working hard, right?
They will know.
I'm committed to getting somebody in this room. Okay, the next is our first flowering basket. Perfect for spring. Bilam. She was with us in Arlington, so she's on her way back. Okay, we're 0 for 4 here.
Flowering basket.
The next flowering basket, our New Guinea impatient. Hopefully you like red. Gay cone. Yeah. She's working hard. She's heavy content on vacation. Is that 0 for 5? Maybe we'll make it all the way through. It's not good for everybody in the room. Okay, anybody like the Cheesecake Factory? Gift card to Cheesecake Factory. No. You can't write only healthy food. Desiree, is it Roy? Or Roy? I can't read it.
Yeah, that's Roy.
She's not here. Okay. Everybody leaving. More likely to get Okay. This Fandango gift card for all you movie buffs. Jim Martin. Jim, are you in? No. It's hard work.
Yeah, they keep working.
Somebody else needs to pick. I'm only picking
We
people who
are
aren't here.
We were on.
Okay, MasterCard gift card. Christina Nuno.
Oh, yeah. No, she's not in.
Jackie, you're gonna pick this up. Okay, our last flowering basket, jewel hanging basket. Janet Wright? Janet's not here either. These are all the people who came early and put their tickets in.
Buffalo wings.
Okay,
You know that's all.
buffalo wings, nice healthy dinner. Somebody.
Certainly want to be best customer.
Danelle Anderson? Heck, you have to do the next one.
I think you need a new drawer.
This is for iTunes. Kathleen Wallen.
Just a drawer.
I'm done.
All right, here's another one, gift card for Oliver. You want to try it?
No.
Barbara Pear.
She said
Okay, you're still 50%. I'm 0.
Yeah, that was Olive Garden. I can't draw this one.
Okay. Amazon gift card. Let's see, maybe my luck will change here. Karthik Rajoli? Did I pronounce that correctly? Karthik?
Oh, he works upstairs at OAM.
Okay.
Everybody else is working.
I'm glad they're working.
This is a spa basket. And Sarah Sitter. Okay.
But I think that means that we have a really small sample here.
All right, we have a gardening kit. You want to try it?
Nope. You're still doing better than me.
How much? Bethany Gilmaker. Oh, Bethany here?
Is that upstairs? That's right.
The group is losing their enthusiasm.
Oscar foodie basket. Want to try it? Jackie Grissom?
She's not here.
Okay, I'll do the next one.
All right, this is a rolling soft cooler.
Is that right for yours?
Don't be here.
Marianne Daniel? Did I pronounce that?
I see a
Marianne?
hand.
Yay! Perfect timing for summer. Thank you for singing. Enjoy. All right, you want to roll.
These are flying squirrels tickets.
Okay. Maybe they'll win some more if you go. Katrina Fontana. For those summer trips. Okay.
Tickets are really good.
Eddie Rowe. Not done yet. For tea lovers, a basket.
Mr. Tila.
Gene Strohecker.
Gold chain.
I'll do one more, and if we don't get it, Becky's doing it.
I did who doesn't win that.
I'm pretty.
Cold beverage dispenser.
Cole's beverage dispenser for those warm days. July and August. Tina Hall. Tina Hall? Okay. Becky, you do the next one.
Auto care bucket. We do it. Ariel Lee? Lee. Ariel, first name?
No, nobody's jumping up and down.
This is the last one, isn't it? Yeah, last one. Duffel bag.
Okay, our last duffel bag. Who wants it? Somebody in this room, I know. Let's see. Wes Clean. All right, we have a dedicated workforce. Well, thank you, everybody. I suspect we'll be able to get in touch with all those people. We did them all, right?
Yes.
Let me just spend a minute to acknowledge the staff who helped make all this happen, including the gifts. Danielle Nichols, Michelle Johnson, Tanya Simmons, Micah Fairchild, and there are other volunteers today, as you'll see. Please thank them for making Public Service Week happen. So what I want to do now is recognize some really special people here. These are our central office public health heroes. If you weren't here in the very beginning, you may have missed it. I said, I think we're all heroes. We're all doing really important work. And they represent really the best of us, but they represent us and the great work that we all do. I think it's important, though, that we recognize some people who do go above and beyond and take their really extraordinary talents. And we have many talented people and many specialties to help accomplish VDH's mission. And particularly, my goal of us being the healthiest state in the nation is not at all possible if we don't continue the work that we're doing and use all of the talents that make up VDH. So we've got, and I think the other thing to say is, this is not my award or the Senior Leadership Award. This comes from you because you are nominated by your peers for this award. I can't think of a higher calling and a higher honor than to be recognized by the people you work with as somebody who's gone above and beyond. So think about that when you're recognized, because it tells you a lot about how you are portrayed or are portraying yourself at work and how much you're valued. But I suspect a lot of it is what you give to the job itself. So we've got 22 people to honor. I'm not going to read the full nomination because I know some people in the past might pass out. We don't need a medical emergency. And I'm between you and ice cream, so that's never good. So what I'm going to do is just pick out some key statements. And again, these are comments from your colleagues. And what I'd like to do is when you're called, please come up. We're going to give you your award. I'd like you to allow us to take a picture with you, and then we'll move on to the next. And when we're done, I think that we're going to try to, I don't think we're going to take a group photo because we don't have enough room, but we'll reconvene downstairs where everybody can enjoy some ice cream. So the first individual I'd like to recognize is Munaj Modavin, and if I mispronounce it, thank you, congratulations. If you'll hold this, I'm going to ask the deputies to stand by you. So Munaj,
Need to get your other deputies.
while they're walk over. Munaj is the systems analyst with the Office of Information Management. And the folks in Office of Emergency Medical Services are particularly indebted because of the system that he helped to develop for them to manage their grants, which is no small task. They have lots of money that they dole out in grants. And what's happened because of his work is they've drastically improved overall efficiency, and perhaps the most important thing, improved customer service and response time. So thank you, hats off to you.
That's good.
Stand in front.
Thank you so much. The next is Nancy Boylan. So Nancy is a generalist on the HR operations team, obviously in the Office of Human Resources. I think that her colleague said that she serves an exceedingly large number of internal customers, and that's really important because we have a lot of internal customers that we all serve. But those internal customers span the state because of BDH's extensive reach. And the nice thing is that she makes time to ensure that each issue is responded to quickly, professionally, and cheerfully, which I know they appreciate. And she's a great asset to not only the OHR staff, but the agency as a whole. So thank you very much. We'll figure this out.
Okay.
Probably by the last person.
Thank you. Thank you for handling my customers too.
So, although I'm gonna have difficulty saying your name
Just
correctly.
say Olo, that's everybody.
Everybody know Olo? So Olo, come on up. Anybody who doesn't know Olo?
Pretty much.
So, you may not know what he does, but he's the Senior Performance Improvement Manager. And quite frankly, we're working really hard to get into the 21st century, thanks to a lot of people's efforts. But one of our strategic goals in the agency is operational efficiency and effectiveness, and to use those tools to do so. Thank you, Olo, for being here, because what he's done is he's allowed us to develop tools or to utilize tools that we've not been utilizing well, and put together not only the tools, but the processes that will allow us to do a better job. We don't have the luxury of working harder. Does anybody wants to work harder? We have to work smarter, and actually Olo is helping us do that. But I think the most important thing about Olo, that smile. People write that he's consistently positive, enthusiastic, and he is an incredibly hard worker. So, Olo.
He also cooks well.
It's true, right?
It's cheap.
Michael Magner. There he is. So Michael is our Central Region Emergency Coordinator with the Office of Emergency Preparedness. He's actually held many positions at BDH. And as you might imagine, his major responsibilities are there. But I think the key thing that he's being recognized today, in addition to his diligence and hard work, is the work he's done with taking this in-house inventory management system to a new web-based program. And it's not only relevant for us, but it's reached national prominence and attention, and really I think is going to make a difference, if it hasn't already, across the country because of the interest of entities like CDC for the Strategic National Stockpile. So Mike is a good example of how good work here is often recognized and makes a difference throughout the country. I can't think of a better example of impacting the public's health than what Mike has done, and I want you to congratulate him with me, Mike.
I gotta get this stuff on right now.
3D version. Anisha Childs?
She's still in Indiana.
That's right. Oh, let's talk about her for a second. So, she's what we call a disease intervention specialist, DIS for short. Seasoned worker. She volunteered to work an outbreak, an unprecedented HIV outbreak in Indiana. We have 2 individuals there, and they're part of a team. I think Indiana asked for about 20 additional folks because of the issue that they've been dealing with. So what's particularly amazing to me, and I think the reason that she was nominated and received this award, that she embodies the BDH mission, period. She does a great job. She's an expert in her field. And here she is, willing to go that extra step and help others. Not unlike what we just said about Mike, your influence goes well beyond the 4 walls of the Madison Building, and even, in this case, well beyond the 4 walls of the four corners of Virginia. And again, if we in Virginia can do a great public health job and an effort and improve the lives of people here, why couldn't we impact more? So my goal of Virginia being the healthiest state in the nation is actually build competition and let's get everybody moving in that direction. And I'm particularly pleased that she's getting this honor, and we'll make sure she gets appropriately acknowledged upon her return, which should be pretty soon, right, Dr. Trump? Yeah, she's put in a very hard 2 weeks up there, and they're making progress, which is the most important thing. Okay. Thank you. So, Lori Furlano, Dr. Lori Furlano. Well, I guess if you look I can't say enough about Lori. We've had some really interesting challenges. Probably the most recent, still ongoing, is the issue with Ebola. And you say Ebola, and it's been hard work. It's been hard work, and Lori has done an amazing job, not only leading the Office of Epidemiology, but all that comes with it. And if we just took the day-to-day work, wouldn't that be enough? Yeah. But frequently we had all these other things. So Ebola isn't really the only focus, but I think what it does is emphasize somebody who has really wonderful leadership abilities built on science of epidemiology and just compassion for the people who are impacted and the people who are doing the work. Lori is a tireless advocate for folks in the Office of Epi, but even more importantly, she's a tireless advocate for the people of Virginia. And it's just been a real pleasure to have her in that position. I think even though she and Dr. Trump were a team, when he was leading the office, we've kind of changed roles a little bit, but we haven't really missed a step because of your leadership. So I thank you for that. And I don't know when Ebola will be done, but I guarantee whenever it's done, something else will come up anyway. And so I hope you're resting up, or you will find ways to rest. But we know that you've worked tirelessly, and that effort is both recognized today, but I hopefully was recognized all along the way by not only us, by your staff, who actually are the ones who nominated you for this position. So thank you.
Because he's your boss. Thank you, Lori.
Thank you.
Christy Gray? So the Virginia Immunization Information System. She serves as the VIIS, that's enough eyes, okay. Business Plan and Data Quality Manager in the Office of Epidemiology. And her colleagues have said that she provides not only strong leadership, but technical expertise. We had, some of you may not know, but we had a significant data issue with the system. And it's a critical tool. In fact, we're trying to build this tool. And on the heels of all the issues with measles, you may have heard about measles, and the renewed interest in immunization, it's really important to have a system that works and a system that's available. So because of her efforts, bottom line, we were able to maintain the integrity of the system and maybe most importantly, maintain our trust as a public health entity, which we can't afford to lose. So with that, let me thank you and thank the colleagues who have nominated you for this.
Go back to work.
Ann Rhodes. Some folks weren't here. So I'll just quickly, and we'll get this to Ann. let you know she's the agency's HIV Surveillance Unit Director in our Division of Disease Prevention. And although she hasn't been here long in that position, under her leadership she's worked with an extensive group of internal and external stakeholders to create meaningful data for people infected with HIV. So she's got important linkages to multiple entities, including our federal partners, and it's because of work that she does that we are able to really impact the lives of people who have very difficult issues to deal with. And one thing that her staff said here is that despite her leadership and looking at the loftier, larger goals, she stays grounded and remains well in touch with her staff. So we'll thank her, and I thank you for nominating her for this award. All right, I know I saw Sandra right in front of me. Sandra Summers, Dr. Sandra Summers. So Sandy serves as a division epidemiologist in our Division of Immunization, and I believe is now wearing multiple hats, right? Which is one of the reasons she's been identified for the award. You've heard me mention about measles. There are certainly significant issues related to immunizations recently. I think whenever you put on more than one hat, something else happens, and that's what's happened recently. But she's a professional, she's expert, and she's been able to manage and juggle the way all of us are. And I think her colleagues mentioned that she takes it all in stride, and she's a role model for other people. People can feel and see her dedication, and I can't think of a more important thing than not only doing the work and being an expert, but for the people that you work with to acknowledge that and be a role model to help them move forward in their roles and in their careers. And I suspect you've touched many a life. And I know in my work with you that you're just wonderful. You are really an asset to the agency, and you represent the community well, and more importantly, we get more people vaccinated appropriately because of your work. So thank you. All right, we have a team award. And I'm going to see if I can pronounce everybody's name correctly. I'd ask whoever of you are here to come forward. This is the HIV Pharmacy Partnership Team, and I'll tell you more about that in a minute. Heather Bronson, Carolyn Campbell, hold your applause for just a second, Brian Collins, Fatima El-Amin, Christopher Barnett, Mackenzie Hall, Chatali Roy, Jean Cadet, and Juana Vasily. So I know we have some of the I'm going to ask you to take them, and then for the ones who aren't here, sure. So I don't know if you all know about this. This is really a great story of an amazing effort. I had the pleasure of celebrating with them after their hard work was done. But what happened is that basically they took a relationship with Walgreens and helped Walgreens become an extension of the health department, period, for HIV. So what happened was, and this was the first in the country, what happened was that, was it 18 months to get there? At least, maybe longer? They created a cost-effective approach to offering testing, reduced the stigma around testing for HIV, and just, I think, probably a fundamental approach in public health is to increase opportunity for people to get what they need, in this case, a test. It was, can you imagine working with a national chain? I can't imagine. And that in and of itself was very complex, required lots of upfront work, and also all the things related to the minutia of the logistics of making it happen, including education, quality assurance, etc. And the end result was that and I think it was because of persistence, right? We only got there because of your persistence, was that we had a successful launch. And probably what's most incredible about this, again, this is at least the third example of a Virginia effort that's going to have national attention. We're going to expand this to include at least another 21 Walgreens. And I can't imagine, knowing Walgreens, that they're going to stop there. So I think we have set the bar, and really it's just a wonderful public-private partnership, which this team can be proud of. We will celebrate with you. We can all be proud, and it's a great example of what we can do here to impact the lives positively of people who are suffering. So thank you very much. We'll do it this way. You can do it with the deputy there. Thank you all. For your personnel. Is Beth Lutro here? There she is. Oh, you're hiding. So many of you may not know Beth because she works with our Office of the Chief Medical Examiner. She's the Senior Executive Secretary, and it's written here that although she's a point of contact for all 4 of their district offices, she's always available to anyone who needs her, choosing not to limit herself to only pleasantly effectively assisting OCME employees, but also extending her talents and goodwill to everyone who interacts with the OCME. And if you don't know, imagine this. It includes grieving families, law enforcement, and attorneys. Can you imagine dealing with that group of people? I'm sure you have plenty of stories. So,
And the medical examiners themselves.
well, you can talk about that too. So her work can take a significant amount of time due to the research and investigation component, but it's written here that she perseveres in an effort to aid her coworkers and to ensure, I think primarily, that the families we serve can move forward with their lives after losing a loved one. And remember, everybody who the medical examiner deals with is a suspicious death of some sort. So your colleague said that you're dedicated, tenacious, and you're not only an asset to the OCME, but to VDH, and probably more importantly, the whole Commonwealth and all the people in the Commonwealth. So thank you, Beth. Chris Hill, I know I saw him. There he is. Right there. So Chris is our maternal and child health lead epidemiologist in the Division of Child and Family Health. And he does a lot of work on a day-to-day basis, helping make sure we have the data that we need to support the program, the grants. And I think what I really enjoy about working with Chris is that I call him periodically and he answers with a smile, or sometimes I peek my head around the cubicle and just responds in an amazingly professional way, providing really important data. His colleagues say that although he's officially in the policy and evaluation unit, the knowledge he possesses, the way he interacts, makes him invaluable member of the whole program. And I think actually of a much larger group outside of that. I've seen him in public settings where he's offered his expertise and the data, and it's really impactful in terms of making better decisions, better policies. I know because of the work that he does and the data that he portrays, he really puts VDH in a good light, and that's invaluable in so many ways. So Chris, thank you very much.
Thank you. Thank you, Chris.
Melinda Wooten. Melinda's a special nutrition programs compliance review supervisor in our Office of Family Health Services and joined the team in 2013. There was a lot of transition. She had worked in Texas, and quite frankly, it was really good to have her and her expertise come here. I think that it's really nice that we're able to honor her and the program, and many of you don't appreciate the importance of the compliance review in the process. These are federal programs that require significant oversight, and quite frankly, I'll say it, I don't know if anybody will agree, but the feds kind of have released the responsibilities to us. And so we really need individuals like Melinda who can take the responsibility to assure that we're doing what we need to do. Because this is a highly visible series of programs, and they come under a lot of scrutiny, and they're impactful in so many ways. Many of you know that our own First Lady has taken the nutritional divide her belt, so to speak, which is really helping get the word out and expanding, but it also is bringing a lot of attention and perhaps even greater scrutiny. So having you and other people like you be able to do this work is really critical. So your colleagues have said that despite all your expertise, perhaps most important is the manner in which you communicate and conduct yourself, demonstrating the utmost integrity and embodying your personal philosophy to guide using simple values of loyalty, duty, respect, selfless service, honor, integrity, and personal courage. Wow. Thank you so much. That's wonderful. We'll work around you. Yeah. Lisa Akers, I don't think is here today.
She's not.
Okay. So many of you may know Lisa, who's our state breastfeeding coordinator in the Office of Family Health Services. She's, I think easily we can say she's a leader in her field and very passionate about what she does. So she's actually helped us bring together many leaders, particularly around the hospitals, and we have had an amazing response to that, which not only benefits the hospitals, but at the end of the day, it benefits the children, the babies who are being fed, the mothers and the families. And what she's done particularly has helped us take a program that's worked very well in North Carolina and adapt it to Virginia so that we can not only recognize those hospitals, but improve something that's really near and dear to my heart, have more thriving infants in Virginia, which means that we can get closer to that goal of having the healthiest state in the nation by getting children the best start that they can in their lives. And the best way, one of the best ways to do that is through breastfeeding. So I can't say enough about Lisa, and we'll make sure that she gets appropriately recognized when she's available. Okay, we are almost at the end. Anybody ready for ice cream? I have a special award because the commissioner has discretion here. So, is Nancy Glasheen down here? Please come sign me back.
Yay!
So I've asked Nancy to come here because I want to give her a commissioner's award. And how many of you know Nancy in your day-to-day work? Would you agree with me that she embodies customer service?
Absolutely.
If we were going to clone anybody for customer service, it would be Nancy. So what you may not know is the customers that Nancy deals with are extensive. And I'm sure she has many a story. But often, not only the internal customers, often there are people who are not terribly happy with VDH. And they're also frequently people of prominence or influence. I can tell you, we are better off as an agency because we have Nancy at the front line of those type of phone calls and interactions. And it really makes a difference in how we can maintain our trust and credibility and really support the work that you do when we have somebody like Nancy who is there honestly covering all of our backs for us because she's providing excellent quality customer service. I wanted to take a moment. I've had the pleasure of working with her in this capacity for just over a year now. And I knew a lot of this before, but until you work closely with somebody, as all of you know and all of you who've recommended your colleagues, you really don't appreciate the value of people like Nancy, people like all of the heroes we have honored today, and their impact, which is huge, often unsung, and often just unrealized. Yet, if they weren't there, our jobs would be much harder. So Nancy, thank you for making my job a little easier, but thank you for making everybody's job better, and thank you for being a wonderful face.
Are we going to have the shining in our faces?
Look at me. Well, thank you all. This concludes the official part. I think what's important here is you've all recognized your peers. What I would ask you to do from here on in is continue that on the day-to-day basis. Everybody has a good day and everybody has a bad day. And sometimes all we just need to get through the day is a pat on the back. So don't forget how critical that is. And if you're having a good day, I guarantee you there's somebody who needs that smile. So pay it forward and it will pay off immensely. VDH has a tough job, but VDH is us, and what we need to do is be a positive face for public health, and in my experience, positivity spreads immensely, and it deals with lots of the negativities out there, so each of us do have control over that, and the fact that you all have nominated your peers, that we've recognized them here today, is just a way for us to step back and realize how important recognition is. So thank you for doing that. Thank you for continuing to do that day in and day out, and we will do this again more formally, periodically. And thank you for everybody who helped us make this possible.